tonight on the first ever COVID talk show hosted by Dar es Salaam Jamaat in collaboration with KSIJ COVID-19 Task Force. Now, before we begin, may I first begin by sending our sincere condolences to all of you and the Imam of our time, Imam Mahdi Ajallahu Ta'ala Farajahu Sharif, on the death anniversary of the first Imam Amirul Mu'minin Ali ibn Abi Talib. And we pray that Allah subhanahu wa ta'ala on these nights, these holy nights, may He grant us the visitation and make us to be alongside the shrine of Imam Ali and Imam al-Hussein salamullahi alayha. Now, coronavirus COVID-19 has overtaken the world. For some, it has changed their lives, but for many, it has changed the course of their lives. Losing loved ones, having to hospitalize your close and near ones. But most of all, for many of us, it has brought the world to a standstill. Whether we can visit our relatives or not, whether we can go for haircuts or not, Eid's coming up. Can we now go for a haircut? Can we start counting our Eid collections? But most of all, can we have food from outside? These are questions that tonight my favorite panel, that is comprised of 4 doctors, keeping me completely feeling out of place because I am not a doctor, but we have 4 doctors, 3 named Muhammad and 1 named Ali. Very interesting. So I'll start by introducing our panel for today. Dr. Ali Hussein Molu, who is a general practitioner and an administrator at our very own Ibrahim Haji Charitable Hospital. And then the first Muhammad of tonight's show is Dr. Muhammad Hussein, famous known as Dr. Muhammad Shabir, who is an orthopedic and a trauma specialist at Ibrahim Haji. Next is another Muhammad, Dr. Muhammad Ibrahim, who is at Aga Khan Hospital. Our very own Dr. Muhammad Manji, for those of you who must have watched our very own final show at Mosque that was hosted on the 13th Rajab, where Dr. Muhammad Manji had given a small talk on what to do with COVID-19. Dr. Muhammad is also a GP at Ibrahim Haji. Now, before we begin tonight's show, may I, first of KSIJ Jamaat, take this opportunity to firstly appreciate you, our dear doctors, for being one of the frontliners. I'm sure it is not easy. Your families must be worried. But most of all, be rest assured, at these very uncertain times, we are praying for you, and we pray that you come out from this pandemic safe. But most of all, may you get the opportunity to be amongst the frontliners when of our time, Imam Mahdi Ajallahu Ta'ala Farajahu Sharif reappears, and may we, Dar es Salaam Jamaat, be represented by you in our medical team. Now, dear doctors, there's a lot of questions that have come in during this pandemic. It starts from having haircuts to, okay, will I actually die? Will I survive? Should I be admitted to the hospital? So, with you, Dr. Manji, since you have been on the front line and you have also addressed the community, let's start discussing with you. The first question was, it might be a bit traumatizing to ask this, but I would love to set the tone for this show. The question is, am I going to die? Should I be admitted at the hospital? Should I have contracted COVID-19? I think, Dr. Manji, you have muted yourself. Can you please unmute your mic? Sorry. Can you try now? Yes, better now. Can you go on? Okay, Dr. Manji, we are struggling to hear you. Have you unmuted your mic? Okay, we are having a bit of a technical issue with Dr. Manji. Whilst we do try and resolve this technical issue, let's go to our very own, for those of you who must have seen him at Ibrahim Haji, running around ensuring that every institution that falls under Ibrahim Haji is safe, but most of all that our patients and our community members are received very well. And most of all, he has been one of the frontliners in ensuring that Ibrahim Haji is not only revived, but most of all, COVID-19 is the battle that Ibrahim Haji want to win. So, yeah, Dr. Manji, I can hear you now, but let's just go to Dr. Ali Hussein Molu, and then we'll come back to you. Dr. Molu, tell us, you obviously have a lot of families that come to Ibrahim Haji. What's what's the advice that you'll give them? How do people protect their families during these unprecedented times?
I hope I'm audible.
Yes, you are.
Okay. So basically, one of the key questions that we get from our patients, from people visiting the hospital, is
Right.
I'm probably having some symptoms of COVID-19, some mild symptoms, a fever, runny nose, a sore throat, or a dry cough. And so what should I do? Do I get admitted to the hospital, or how do I live? Should I go find a separate house to live in, for that matter? When it comes to these symptoms that people normally experience related to COVID-19 or any other infection, COVID-19 particularly is highly contagious and can spread very quickly between people, among families. And the advice that we give to patients presenting with these symptoms is the key words that we've heard for a very long time: self-isolate. It is very important to understand what self-isolate means. Self-isolate doesn't mean closing yourself, in a room without any access to the to food or to the outside world, or that's the end. 14 days of total depression. That's not what self-isolate actually means. Self-isolate means stay at home in an environment where you are having minimum interaction with people, including your family. So I would just like to point out two key things when it comes to self-isolation. If you are experiencing symptoms and there is an opportunity of moving out, or staying in an environment or a room that is away from everyone else, that is a preferable option. And if you're living with your family and you have no other option but to live with your family, it's not very easy to get a separate house or a separate room, then you should maintain as much distance from your family. This includes taking precautions which are normally advocated for, like wearing a mask. You're at home, wear a mask so that you are keeping others safe. When you're at home, don't touch areas or surfaces that are, used by your family members, the frequently touched surfaces. When you're at home and there is an option of using a separate washroom and a bathroom, go that way. And lastly, hand hygiene, respiratory hygiene, all the things that will prevent the transmission of the disease from one place to another, from one person to another, should be adhered to. And so that's the advice that we give to our patients normally: self-isolate with minimum interaction with your family members, with the society in general.
Thank you, Dr. Molo. Very interesting. For those of you who haven't collected your masks, KSI Dar did have a very interesting scheme, masks for every community member, and which I feel that the Dar es Salaam Jamaat and the COVID task force need a bit of appreciation from us for the way they've handled everything. Now, doctors, one of the key things, when COVID-19 came out, it was be careful about your elderly. They are the most vulnerable in this disease. And it was so funny because, including myself, we have elderly at our houses. So you try and stop them from coming out, which is not easy because, they've never been used to sitting at home ever since their childhood. Now, however, it seems like the curve has a bit moved somewhere else. And now it's more to do with kids. Now people are saying, actually, children can now get COVID-19. Now, Dr. Ibrahim, since you have had a very good experience working in Cape Town with children, and I'm sure Aga Khan Hospital has exposed you to a lot much more than that, tell us, can children contract COVID-19?
Assalamu alaikum, Muhammad Jawad, and assalamu alaikum to your viewers. Yes, experts are still learning about this COVID-19, but there are fewer children who have reported cases who have gotten the COVID-19. But there are children who are at very high risk of contracting COVID-19, especially those children who are on chemotherapy, those children who are on immunosuppressants, which makes their immunity go low. Also, those children who are malnourished. In children, there are younger children, then there are older kids. In younger children, we usually see they come with vomiting, diarrhea, cough, runny nose. But in older children, along with it, it comes with sore throat. But it doesn't mean that all this is COVID-19. I would advise, if we have parents who are viewing this show, they should immediately get in touch with the general practitioner or the pediatrician, and either they can speak to them, either teleconsult, and they can discuss about the child. But also, I would like to point out there are danger signs which I need to mention to the viewers, that when they see these signs, they should immediately seek medical attention, not only related to COVID-19, but to other illnesses. Uh, Things like difficulty in breathing, prolonged pause of breathing, seizure, vomiting everything out, excessively crying uncontrollably, looking pale and weak. These are all the danger signs that you need to seek medical attention.
Sorry, I was just on mute there. So, dear doctors, Dr. Ibrahim, you said something so interesting. As soon as symptoms start developing, you need to start addressing them. That's very true. But it's interesting that the kids are also exposed to this. Now, Dr. Muhammad Shabi, I want to bring you into this conversation because we have discussed kids and how they are vulnerable to this disease and everything that comes with it. But there's also this question about not the elderly, not the kids, but those in the middle ground, just like ourselves, the age group that we come through. Though I'm pretty sure all of you, or majority of you, are quite elder to me. The group that comes under our age category that are smokers, those who are avid smokers in our community, which obviously seems to be an issue that can be resolved on a different talk show, but smoking does seem to be quite common in our community. How can people who are smokers, first, question number one, are they more exposed to this disease? If yes, how can they look after themselves? If no, then I'm sure the smokers must be quite happy right now.
Thank you for having us as part of the show. I will begin by quoting the references that is given. So an article was released saying that smokers have protective effect from coronavirus. It is very interesting when you dig deep into that article. The main evidence that they use is, for example, in China, the people who were admitted due to COVID, only 5% were smokers. Whilst in France, 30% of patients who were hospitalized because of COVID were smokers. And hence they say the other 95% and the other 70% were non-smokers, so that smoking has a protective effect. One thing we should know, the principle is that tobacco kills 8 million people annually, and that's a fact. It's proven beyond doubt. Even in cigarette packets, even in the billboards, it says that cigarette is injurious and tobacco is injurious to health. So that is there, that's a fact. Cigarette smoking and tobacco is also a known risk factor for causing respiratory illness, not only the number, but the severity. If someone is a smoker and gets respiratory infection, he or she would have a more severe form of the infection if he or she is a smoker. And we know from COVID-19 primarily affects the lungs. Of course, it also affects other systems, the heart, the brain, the kidneys, and all that. But primarily it affects the lungs. So logically speaking, if smoking compromises function of the lung, and then you're adding on COVID, that's a worse prognosis. Also, we know that other risk factors for having a more severe form of COVID is, for example, cancer, immunosuppressants, having, for example, diabetes mellitus, cardiovascular conditions like having a bypass or heart conditions or heart block. And all this, what's the main risk factor? Tobacco. So there we go. What we can learn from that also is smokers have a 14 times more higher chances to need assisted ventilations if they are hospitalized. So I was reading an article today from California that a person was smoking for 40 years and he tried quitting for 4 times with failure. A few weeks ago, he saw his father being intubated. Incidentally, his father was also a smoker. So he got COVID-19, he got intubated to help the lungs function, and therefore that was the instant that he said, okay, now today I'm quitting to stop. So that's the effect that smoking has on COVID. There are also a few other plus points for those who smoke with regards to quitting to smoke. This can be that time, that tip of the time that can make you to stop smoking. For example, only a few minutes after you stop smoking, your heart rate and blood pressure goes back to normal. It takes only 12 hours, only half a day, for your carbon monoxide levels in the blood, which is a poison in the blood, to go back to normal levels. It only takes about 2 to 12 weeks for your lung functions to go back to normal. So the bottom line is smoking is injurious to health, whether COVID or no, so please stop smoking.
Thank you very much. There is some plus points, and I said, "Oh my God, is it going to say that smokers are now excluded from this virus?" But very interesting. Dear viewers, if you or your family or your friends or anyone that you are very close to is a smoker, this is your opportunity to explain to them that maybe this might be the right time to call it off and say, "Hey, you know what? I'm going to go for a healthier lifestyle." Now, it's not easy. I'm pretty sure it's not that can just be done overnight. So if you would like to stop, and if you are in Dar es Salaam and you want to stop, get in touch with the COVID-19 task force support group, and we have counselors online who will try and assist you to go through this. Now, I'm bringing you back, Dr. Manji. You know, I think when we started talking about death, the speakers stopped working and the mic decided to mute himself. So I'll bring you back. Let's talk about the disease itself. You know, there is a tendency for people to say, hey, you know, it was from China, it came from here, this is what happened, everyone is just serious about it. But let's go to the root of it. What is COVID-19 and what happens when someone does contract COVID-19? You know, is there a life, you know, is there a, I wouldn't say a map, but is there a cycle that it goes through from, you know, level 1 to a level where it's not treatable, or can this be treated in a very simple form?
Can you hear me now?
Yes, I can, but it's a bit lower. If you can just speak a bit louder on the mic. I know doctors are very soft-speaking people, but if you can just give us a bit of volume, please.
Thank you very much for having me here today. So I missed the first question, but probably I will just connect the answer to that first question with this one.
Okay.
So coronavirus, this COVID-19, this disease has been with us now for about 5 to 6 months. If I'll just go back to the science a little bit, it is a viral infection, like many other viruses that we know. It is shaped like a crown, and therefore it is called corona, which means actually crown. These are a group of viruses that are not new, although this particular strain is a new strain. And that is why these are a group of respiratory viruses. They cause a respiratory illness. Okay, so these are predominantly symptoms which will begin with something like a fever, flu-like symptoms with runny nose, and a cough and a cold. Okay, and these are usually the milder symptoms. And then towards the extreme end now, you have those people who tend to have difficulties in breathing and who tend to require other supportive treatments and advanced supportive treatments like assistance with breathing and other ICU level treatments. So these are the symptoms of the disease. Again, the transmission, remember, these are droplet generated. Okay, so these are droplets that are generated either when you cough or when you sneeze or when you talk, and these are aerosols that are generated from an infected person, which either infect another person directly or via certain objects. So for example, if you are writing on a pen and you sneeze and some droplets fall on your pen and you've held your pen with your hand, and if that hand goes back to the nose, or like what Ali Hussein had said, then there is a risk of transmitting it. Okay, and if you understand this general scheme of this disease, it will also make it very clear for you to understand all these measures that have been put into prevention. Okay, it is from this rationale that all these preventive measures have stemmed. Okay, when we talk about the progression of the illness. So this illness is usually a disease that evolves in two phases. There is the first half of the disease, which is usually the first 7 to 10 days. These are usually the symptoms where you get the flu and the cough. These are usually the mild symptoms which everyone has experienced from other flu-like illnesses and infections. Then by the time the first half of the illness, the first phase of the illness is over, there are some people who just tend to do well, okay, and recover. However, there are a certain group of patients who tend to progress to the second phase of the disease, whereby the virus itself is not at fault, but it is how the body, the immunity of the body responds to that virus. So the body's immunity tries to mount an attack on the virus, and it's kind of attack on its own. Okay. And that is what causes all the major problems that occur in these patients till they require the ICU level care. So having talked about this general scheme to make everyone understand how this disease is, I think the first question you asked me when we began this video conference is, will I die if I get the coronavirus? So there is a general answer and then there is a more specific answer. Worldwide, over these 5-6 months, the studies that have been done have showed that the mortality rate of this disease, which means the death rate, the rate at which people will die, is between 2 and 3%. Okay?
Right.
That is a very good statistic to hear. Okay, that the death rate is probably low, but when you divide all the people who die into different groups, so for example, if you divide them into different age groups, then we see that towards the older age spectrum, the death rate is even more. So for example, in a Chinese study, it showed that those who are 80 years and above, the death rate can be up to 15%. Okay? And this trend actually tends to grow from the time you reach your 55, 60 years old. It keeps on increasing all the way up there. This brings to light the important point of protecting our elders. Very important, okay? So although the overall death rate is buffered because it cuts across all the ages, but if you look at specific vulnerable ages, it is quite high. So we need to take care of them. The second thing is, if you divide the deaths into the type of illnesses these people have had, the comorbidities. So for example, if you are a diabetic, your death rate is higher. If you are a patient with heart problems, your death rate is higher. If you have pre-existing lung diseases, your death rate is higher. If you have pre-existing kidney diseases, your death rate is higher. We know that all these illnesses, the ones that I have mentioned, are all non-communicable diseases. They are a result of our lifestyle and our risk factor. So when people are looking at what measures can be done to control the disease, and we are looking elsewhere, let us first look at ourselves and look at our risks that we have, okay? And what we can do within ourselves to control that risk. If I am obese and that obesity is a risk for me to get a severe disease, it's time for me to get fit. If I'm diabetic, it's time for me to make sure my sugar is well controlled, so that if at all this disease comes, milder course, okay? So not everyone will die. Everyone will die. Please do not panic. This is not the idea that we are giving. The message behind is very positive. But if you are in certain vulnerable groups, you need to take extra care.
Interesting, Dr. Manji. Your viewers, you're never going to get anything as detailed and as concrete as Dr. Manji has just given to us. I think it's so interesting, when you look at this whole disease, it has brought a lot of good, but also has brought a lot of stops to our world, which sometimes you can consider it bad, but everyone can categorize it themselves. But the community as a whole has always been very dependent, on community organizations, which I feel is one of the beauties of our community. Our community members are always united and are waiting to get, guidance from the top. Now, before we go to how the community can help into this, one of the most commonly asked questions is, we have maids at home who come in the morning, and then leave in the evening. Come in the morning. Okay, and what happens during that process? I think one of you, your mic is on. If you can just mute your mic because I can get an echo. Okay, so back to the question, which is we have maids who come in the morning and they exit in the evening. They obviously use public transport, which is one of the biggest concerns because there is no social distancing, there is no isolation, as Dr. Molu said. So, Dr. Mohammed Shabi, let's go back to you. What advice would you give to homeowners, to people who have families? You know, for some reason, which is a very good thing because as much as it creates employment, we are very dependent on this workforce. So, is it advisable to have maids coming in and going, or would you suggest something completely different?
Okay, so one of the things that we need to know before we dwell into this question is what is the risk, what is the threat. So 15% of the patients are asymptomatic. So 50% of patients who are infected will not show any symptoms. So that is something to take into mind. Taking that into mind, if a maid or if a relative or if anybody is coming into the house, they can go with the infection out and expand there and distribute there, or they can come in and infect the ones who are within the house. So it's a byway, it's not a one-way traffic. It's not that we should say, oh no, you know, they are the only ones who can bring in the infection. We should also keep in mind and protect them, the housemaids, the house helpers, because they will also, for example, if they are living in a house with many patients, many people in one room, that it is more riskier for them to go and infect others. So that being said, there are a few steps that can be done. The first step that we advise and we advocate is stop house helps from coming home, period. The household members should be self-sufficient and be able to work up the chores and distribute the chores amongst themselves. A good way to look at it, or looking at the glass half full, for example, if we ask children to make their beds or wash their plates, they will become self-independent. It's a virtue to have within our kids and of course within ourselves also. So that is one. We'll also be able to practice our cooking skills, for example. I remember the last time that I cooked, my father and myself were alone at home and he needed tea, and me with my chest high and head held up, I said, I'm gonna make the best tea in the world. You will forget everybody else's tea. And I made it. I was very happy with the tea. I serve him. He says, beta, tukro vijay, khan vijay, ke namak vijay. And I just realized that I put salt instead of sugar. So that is a way of gearing up our cooking skills. But if at all we really can't, we have some elders in the house and they need help and whatever. So we can have them either stay in. So ask them, if possible, if it's convenient for them, to stay in. So they should not go in and out, but they should stay with you. Of course, oh yeah, just by the way, if you ask them to stay at home, please make it a paid leave. Do not leave them unpaid, otherwise they will suffer with hunger. So that's a point to note. Coming back to the second point, we can convert them to a day and night household. So they should stay with us 24/7. Together with that, even if that is not possible, the least we should do is take all the measures that Alusen mentioned with regards to hand hygiene, hand washing. So for example, when they come in, they should leave their shoes outside. They should change their clothes. I don't know how feasible it is, but if they can take a shower and after leaving, because before leaving, if they have the infection, they should not infect us. And before leaving is when if we are infected, we shouldn't infect them, and they should not take it to the community at large. So that is what we advocate and advise for the household. But also they should wear masks, and also we should wear masks. We should maintain the social distancing, hand hygiene. For example, if they are symptomatic, then definitely get them help, get them see medical personnel, get them treated. on time. So that is a thing that we can do with household. Yeah.
Interesting, Dr. Muhammad Shabi, you say that. Two very good points, which I fully agree with. One is it could be an opportunity to practice your cooking skills or your ability to help out at home, and it's something I'm sure those watching us from the West are looking at us and saying, yeah, it's probably time now for you to understand what we go through every day. So it's time to that. But number two, talking about paying your your employees, even though you have put them on a leave, which is something so very important. It's a very Islamic thing to do. But I have a poll for our dear viewers. How many of us at home have a maid who comes in or a helper who comes into the morning and then leaves in the evening? If you can answer that poll, and then we'll discuss this topic a bit further into detail once we get the answers. Dr. Molo, I want to bring you into this. With all that Muhammad Shabir has said, there is something that pops up as the community. Now, what does the community do for us? How is the community playing its role? How are the leaders of our community making a difference to us as COVID-19? I wouldn't say we are affected by COVID-19, but we live in an environment where we could be exposed to it any time of the day. So what can our dear viewers or our dear members across Dar es Salaam, do with our community leaders? Do they start calling onto the helplines? Do they start walking into Ibrahim Haji and say, I'm a Khoja Shia Isnash Dastam Jawad member, I have an issue and I feel you guys need to address it?
Thank you, Mamajad, for that question. I'm at any point in time, I've been the most proud being part of this community at present because of how things have been tackled when it comes to the COVID-19 outbreak. In the initial stages, when we just found out that Dar es Salaam or Tanzania is already part of the countries that have been affected by the COVID-19, a task force was put up together by the Jamaat, and this task force aimed at various aspects of the COVID-19, including primary prevention, setting up emergency services. Amongst the biggest achievements that our community has had during this outbreak is the establishment of a helpline or a call center. And this is a call center where any member of the community can reach out to experts, to trained people. And again, this is not a medical helpline. When I say it's not a medical helpline, it does not consist only of doctors who are going to tell you, you need to do this test and you need to get this medication. This is a helpline that involves a lot of aspects. It has a mental health aspect to it. It has a task force that deals with food. A lot of issues that are being addressed by the task force. And under the medical side, there is a force that has been developed which is under a primary health responder. A primary health responder is someone who is there on call or on duty to direct you to take the appropriate and necessary action immediately. So if you reach out to the call center presenting with symptoms or having any difficulty, a medical difficulty, the team is absolutely ready 24 hours, be it at 12 midnight, be it at 3 a.m. to assist you and to guide you through the proper channel of management. Do you need to come to the hospital or no, you just need a simple check at home? All of this is arranged by the primary health responder. And Momojad, you would be surprised, we've been able to pick up some very serious cases. And these are not COVID related, but other disease related. Issues like severe malaria, issues like heart attack. The primary health responder has been able to pick up these cases and able to assist on time. And I'm really, proud to say that the time and effort that this committee has put in is, tremendous. So apart from us, the four of us here on screen being frontliners, these people are no short of frontliners. They have been able to address issues that probably, if we had missed, we would have been headed to a disaster. And again, I'm encouraging all community members to reach out to the helpline as soon as they feel unwell or they need any sort of help, because this hotline is available 24 hours for all community members.
Interesting, Dr. Listen, you say that, and I agree with you. Not everything right now is COVID related. You could have anything else, and it's okay to ask for help. I'm going to come to this question about whether it is okay to ask for help and whether it is okay to say that, hey, you know what, yes, I was diagnosed with this and I have now recovered. But I want to bring Dr. Ibrahim into this. Throughout this pandemic, countries have done lockdowns where a lot of times the focus is always on people who go to work, or on mothers who now have to handle their kids at home, or how much income has now decreased because of the amount of people who have been laid off work and everything. My concern, however, and with the field that you obviously work in, is the kids of today, and I think kids in general are not used to sitting at home. They are those who love going out, they love going for a drive, they love their outdoor activities, and life has just come to a standstill, and it's, I'm at home, I'm gonna play with my toys, I'm tired of my toys, so now what do we do? So as parents, then you expose them to technology devices, and now you are, okay, now my son or my daughter can't get off the iPad. However, I personally feel that it is time that parents have discussions with their kids about coronavirus. I have friends and family who have kids, and when you speak to them and you ask the child, do you miss school? And they'll be like, yeah, I do miss school, but I only go back to school when coronavirus is over. But the question that here comes is, how can parents sit at home and have conversations with their kids and tell them, look, this is what coronavirus is, and this is where we are heading?
Sorry, MJ, I missed your question.
Okay, so I'll go back to the question. The question is, how do parents now, at this current situation, sit at home and have discussions with their kids and start telling them, look, this is what coronavirus is, this is where we are now, this is where we were, and this is where we are trying to get?
That's very interesting question. It's very important to set the tone with your children and ask them what do they know about the coronavirus, COVID-19, and make sure that they have the right information. And that way that you can start a conversation with them about the COVID-19. If they ask you questions and if you don't know the answer, it's okay to say, I don't know. But you can tell them that let's find the answer together. That way, the children feel they are involved, and that way you also get to know the facts rather than listening to the news headlines. Other thing is when you speak to your children, speak to them in a comforting way and hopeful way rather than in upsetting tone, very emotional. That way I would not recommend. Other thing is there are some children who ask a lot of questions. There are other children who don't ask, but it's okay. If they don't want to ask, don't force them to ask. And other thing is the children they if children they want to know something, you give them very specific information. Don't give them too much information because different age of kids have different concept of understanding. I don't know if that answers your question.
It does, doctor. It's so, I mean, I can now, not that I need to verify, but I can now verify and certify you really do work with kids at the hospital, since you know how they vary in their understanding and their approaches. Dr. Manji, let's bring you into this again. You mentioned about how this disease has evolved and how much it does expose people to. The question, however, that people do have at their homes is, hey, do we go back to hospital, and should we take our family members to the hospital? If I do take them to the hospital, am I exposed to this virus? Are hospitals sanitized enough? Are they disinfected enough to be able to prevent the spread of this disease for anyone who does visit a hospital?
That is a very, very important question. That is something that we need to discuss about. I think with the emergence of the coronavirus, one thing that has that everybody has Hello?
Yes,
you
we
hear
can hear
me?
you now. Yes, we can.
Okay. So I'm saying that one thing that has become very clear with the emergence of the coronavirus is that everybody has understood that the hospital is not a place to loiter around. Okay? That is a concept that people did not understand before the emergence of the coronavirus. Okay? So the hospital is not a place to loiter around. However,
Okay.
having said that, please don't run away from the hospital. Uh, all the hospitals in the city have taken precautions to the best of their capabilities to try and
Right.
separate suspected kind of patients from other general patients. Okay, all hospitals have done that to the best of their abilities. Disinfection protocols are running around the clock. Okay,
Right.
everything has been done to try and ensure that you have a safe environment in which to bring your loved one who may be sick from whatever illness. Okay,
Right.
having said that, if there is a minor illness that can be taken care of either via
Yeah.
innovative methods, we have to get innovative in this time, either
Okay.
via telephone consults with your doctor or via video consults with your doctor. And here I should stress the importance of the helpline, the hotline that we
Right.
have, the Jamaat hotline. Call, if you have someone who you think is sick and needs medical attention, call the hotline. Take the perspective of the first responder who is on the hotline. He will certainly guide you in a correct manner. Okay?
Okay.
So use these innovative methods. See if the problem can be sorted, okay, without having to come to the hospital. But having said that, there are cases whereby people have delayed coming to the hospital out of phobia, while the patient really needed medical attention on time and they have come out of delay. Okay,
Okay.
so please, that particular phobia which you have, that if I even see Ibrahim Haji or if I see any particular hospital in this era, then I'm going to get infected, that phobia is very, very wrong. If you have a relative who needs medical attention, try and make use of the hotline. The hotline is there for your assistance. If it cannot be sorted via phone or via video call, the first responders on the hotline will give you the correct advice, in which case, if it needs to be brought to the hospital, patients will come to the hospital. During this time of crisis, how many times we have had full hospitals, different hospitals which are full, and when patients needed hospitalization, it is the first responders who managed to find out which hospitals have an empty space to bring this patient in. You see?
Interesting.
So the first responders are actually very, very good. Okay, and it's a very useful modality of help that everyone should make use of.
Very interesting. You know, technology does bring a lot of good out of everything. As much as we have been criticizing technology for bringing people far away closer and taking people closer far away, I think it has brought in a lot of good. And like you said, one of the perfect examples is the ability to consult with a doctor when you know, or through a video call or through a phone call, which is a fantastic opportunity. However, now I want to bring out you. So we'll go sequence wise. We'll start with Dr. Ali Said Modu, and then we'll go to Dr. Ibrahim, and then Dr. Muhammad Shabir, and then Dr. Manji. 30-second answer, and the poll is now live on your YouTube streams. You will see a poll. The question is, how seriously have you and your family taken COVID-19? A, very highly. B, on a medium scale. Or C, on a very lower scale. Now, my question to you, our dear doctors, is how seriously do you think our community members have taken COVID-19 in their houses and in their daily lives? Dr. Molo, we start with you.
MJ, you're really putting me on the spot here. So I think the community has done quite well when it comes to, you know, trying to follow the principles that have been given by the WHO, by the Jamaat, and people are doing a lot of reading. I have a friend, a very close friend, who's as young as I am, an amazing immunity, probably not got sick in a year, but he's been home for the past 5 weeks, and he has even refused to see me. That's how seriously some people have taken, you know, COVID. I think more emphasis and more seriousness needs to be taken by the elders. We still see some elders around. and they remain to be the most vulnerable group. And so I think we've done well. We've done very well as
Okay,
a
so
community to
high,
crack the
medium, low. Where would you put us? High, medium, low.
high. I would put that as high.
Interesting. Very diplomatic answer from a doctor. You know, doctors are so smart. They have a way of navigating through the through the question until they give a very diplomatic, satisfying answer. Let's go to you, Dr. Ibrahim. You seem to be very happy with Dr. Molo's answer. How do you think the community has taken this disease?
I think I'll start with my example at home. My dad is 68 years old, and 24/7 he's like working. He owns the garage and all, but we are putting on isolation at home, social distance, and we have given him extra tasks to look after the grandchildren.
Very interesting.
So I think our community has taken it very well. I think they've got the right information, and also with this interview also, I think they will just understand more from what we are giving them the right information. So they've taken appropriate precautions from what I've seen and what I've been hearing around. So I'll say they've taken high precautions.
Dr. Ibrahim, you are being another Dr. Ali said playing very smart. Let me twist the question for you. According to you, looking at the community at large, how seriously do you think kids have taken this disease? A, high, B, medium, C, low.
Kids, it's very difficult, but my children, they always ask me, Teddy, how is the virus doing? Do you have a lot of cases and all? Right. So they are aware, and they also always they remind me to put on my mask, face mask when I go to work. They also show me how they are washing their hands with soap and water. Okay. And also at sometimes they do social distancing also with me too. I can't even hug them and kiss them. So it's a very that's the situation at home.
Again, again, let's put it this. You are blessed to have kids who have a doctor at their houses. As a doctor, how seriously have kids taken COVID-19 in our community? A, high, B, medium, C, low. I think, Dr. Ibrahim, can you hear us?
I'll say medium.
Interesting. I like that. I like that. Very good. Dr. Muhammad Shabir, let's come to you. You are an avid sportsman. You love your sports, and I've obviously seen you play quite often. Tell me, how do you think our sportsmen have taken this COVID-19? Obviously, you can give them the benefit of doubt because a lot of sporting facilities are closed. But in your friend circle, those who are avid sportsmen, have they taken this disease seriously?
Yes, they have. Just a point in note that COVID does not mean that we should stop all sporting activities. It doesn't mean that. It should mean that we should avoid sports which have lots of congregation. It doesn't mean that we should stop Jamaat prayers at mosque, means we can't pray Jamaat prayers at home. It takes only 2 people for Jamaat prayers. So sporting, so you can go for a jog, you can go for a walk. That is healthy. It will make you healthier. It will boost your immune system. Right. But don't say that, okay, I used to go to the gym 7 times a week, and now I should completely stop and stay at home and eat all the carbs, samosas, kebabs, and everything. But coming back to your question, I think the community overall has taken it very seriously. Nice. So yeah, even my kids, for tell them, do you miss school? They say yes, they miss school, but we can't go to school because of Corona. So once Corona goes away, then I will be able to go to school when I'm happy and safe and in a more friendly environment. I hope that answers the question. So, a bit less politically.
Yes, but you just like the previous 2 doctors have dodged the question, but the way you're heading, it looks like it's high for you. Dr. Manji, you have been on the front line. You have been very active dealing with community cases. Tell me, high, medium, low?
I'll answer it in three parts. I think my honest opinion is that about 2 to 3 weeks ago, the bar was towards the high.
Right.
Okay. I think now the bar is a little wavering and going towards the moderate. Okay, and
Okay.
that makes me a little bit worried because with these great nights coming up, okay, and the great event of the great day of Eid coming up, if our bar starts to go down to the moderate, okay, then the disease will start going to the severe. Okay.
Okay.
So I wish that we still maintain that level of vigilance that we maintained 2 to 3 weeks ago, and let's not get complacent at this critical time.
Right. Interesting. Before we go to one of the most sensitive and emotional aspect of our Ramadan lives, which is the day of Eid, for those of us who love our pre-Eid haircuts, just right before you go for Eid namaz, this is now going to be about you. Can you go for a haircut? Can you order takeout biryani? Can you go out for dinner with your family? But before I go there, my question to you doctors, I'll start with you, Dr. Manji. Is there a cure for this disease, in the sense that are there any medicines that could help contain this disease?
Okay, this is a very important question that you have asked. So I will mention again that we have experience with this disease worldwide for 5 to 6 months now, and the information that has been generated in these 5 to 6 months has been huge. Okay, so while I don't have that reassuring answer to tell you yes, this is the cure, I will tell you that there is a lot of information out there to guide your doctors about what potentially can be done at different stages of the disease to get you to improve. There are good supportive treatments that can be given. If you have a fever, there is something for you. If you have a cough, there is something for you. If you are dehydrated, there is something for you. If you are breathless, there is something for you. Okay, we have seen that oxygen, just oxygenation, good oxygenation to these patients, in a vast majority is usually sufficient to get them better. Okay, so if you are looking for that miracle answer from me, no, there is no cure. Okay, but still a lot of things can be done for you. Please, this is not a time to despair. This is a time to be resilient.
Interesting. Dr. Manji said that. Before we continue with this topic, I just want to bring in a message that has come from the Vice President of Dar es Salaam Jamaat, Al-Haj Muslim Megji, who has offered his sincere congratulations and appreciation to the staff of Ibrahim Haji and to our doctors who have done a fantastic job and have always been at the front line. And whenever called upon, whether it is in the middle of the night or in the busiest of days, they've always been there. So he has an advice that please always be there for the community and make sure that should you ever be called upon, you should be available for help, which I'm sure all of you do it. Now, Dr. Manji, it's interesting you say all of this. I want to bring Dr. Ibrahim into this. Let's talk again about kids. Obviously you can't overload kids with medicines. So what happens? How do you start treating a child who may have developed some symptoms?
Can you repeat your question, MJ? I think my connection was slow.
Okay, so I'll just repeat it. How do you start treating a child who may have developed symptoms of COVID-19?
Okay, very interesting question. You see, in our pediatric clinic, we see a lot of children, and out of 8 or 10 of them, most of them have fever, but it doesn't mean that you see, there is always an overlap. But what happens is with COVID-19, they have very high grade fever, they come with vomiting, they come with diarrhea, but also children are exposed to different varieties of virus. It doesn't mean that it's COVID-19. And also what we do is we start with simple treatment. We give paracetamol at home, but those high persistent fevers which last for more than 4 to 5 days, we advise parents to seek doctor's help for them and do a teleconsult, or it's possible to take the child to be taken to hospital whereby blood test and also child can be examined so that other diagnosis can be ruled out.
Okay, interesting. So doctors, I am now going to direct rapid fire questions to you. I need a 30-second reply to my questions, because after that I'm going to bring up the most emotional aspect of Ramadan, which we look forward to. 30 days of fasting, 30 days of eating, absolute unhealthy stuff. I would say that for myself. I'm sure you, as doctors, must be having your own meals that abide by your health and safety concerns. But everyone looks forward to it. But I want to take this topic a bit later. I'm going to ask a rapid fire question. We will start with you, Dr. Ali Hussein Molu. Let's have these two answers for these two questions. Number one, when and how can you verify information that's coming your way? There's so much information out there. Everyone is, this is COVID-19, there's this medicine, and there's that has happened, and this is what we have read, and this is what the states have done, and this is what other countries have done. The question is, how do you verify authorized information and information which is really acceptable by doctors?
That's very interesting, MJ. You see, there's a lot of information, as you said, and there has to be a criteria of deciphering which information is correct and which information should I be forwarding. And there are, principles of how to accept information. So one very sad thing that has been happening is people read headlines. Shule zinafunguliwa tarehe 31. And forward. Parents get happy. Finally, we are free, and the kids are going back to school.
Right.
And that you click on the link that headline is attached to, and you find out it's just a blog. It's just another, fake news. So
clickbait, as they call it.
you must look in front of the headline. You see what the information is. Read thoroughly. Look at the images that are associated with the, headline. Ask the experts. Do not forward information, a medical, prescription that you have no idea about. You have people who've gone to medical school for those prescriptions.
Right.
So please ask them. And lastly, we follow our principles that Islam has always been telling us, and that is to judge if the information that you have been receiving, is it, by sharing it, is it going to be beneficial? So I know you've told me 30 seconds, just give me a few more. There was once a few weeks ago an information message that was spread out. Mosque infected, Ibrahim Haji infected, the whole street infected. And we started asking ourselves, did they test the mosque and find out it was coronavirus positive, or did they test the street for that matter? And that brought a lot of issues when it came to seeking out healthcare. So all I would like to say is, in general, look at it as also an individual responsibility and Islamic responsibility. Don't share things, or don't spread things which you are unsure of. Look at the sources. Look at WHO. Look at CDC. Look at the Ministry of Health. Right. Verify the information before spreading it. Yeah, that's all.
Interesting you say that. Dear viewers, I'm just going to bring your attention to this. If you do receive any information that is not verified by the Jamaat and by any doctors from our community, please do not take that seriously. Do not start spreading messages that do not belong to our community. Do not start spreading messages that are not authorized by our community leaders. This could lead to a lot of panic, and this could lead to a lot of trouble for us. Please, dear viewers, wherever you are, for those of you who are admins in WhatsApp groups, take necessary precaution. Do not let anyone post anything that is not verified by the community or by the government or by the doctors that are in this panel or in the COVID-19 task force. Dr. Hussein, your last rapid fire question. I need a 20-second answer. When will all of this come to an end?
That's the question my wife is asking me the most, because I've isolated from my family, and that's what she wants to hear most. Unfortunately, even the WHO day before yesterday gave a statement where no one can answer that question. When will this come to an end? Remember, this is a novel virus. It's a new virus. No one can tell you exactly which time, or will it disappear miraculously? Is it a seasonal virus? We don't know yet. We all know that it has affected the world, the entire globe, every country, it's difficult to do. So yesterday, I was reading an article by Dr. Michael Ryan, one of the spokesperson of the WHO, who, by the way, Mohammed Shabir is a former orthopedic surgeon. So don't feel like, you're an outcast in this COVID war. And Dr. Michael Ryan was saying, we don't know, maybe we will have to live with this virus, just like HIV. It could disappear like SARS and MERS, but there's a chance of us having to live with this virus. And again, the precautions that are there in place are sufficient enough for us to be cautious and keep away from contracting this virus. So when is it going to end? I am sorry, that is an answer no one, including the WHO or CDC, can give you.
Interesting, you said, Dr. Mullah. Thank you very much. Dr. Muhammad Shabir, let me bring you into this equation. 20-second answers for both, because not only are we running short of time, but we have viewers who are very, very agitated about Eid. And I think a lot of us, this is one of our secondary source of income, and the highest tax-free income that you can get in the month of Ramadan. Let's get to you. You live, let's say you stay in a building, and you do manage to find out that your neighbor has developed symptoms and has tested positive for COVID-19. Should you be worried? What should you do?
It's a very interesting question, because one time someone told me that my neighbor is sick and he thinks he has COVID, and it was not verified information, and they were all running away from him. I said the least you can do is call him, talk to him, ask him if he needs something. See, Islam is a holistic religion. It not only teaches us how to pray or how to fast or how to go to Hajj or how to pay zakat, for example. It describes and prescribes for us the politics, the economics, but more importantly, the social, because human beings are social beings. So we need to know how to live with our neighbors. It is said that the Prophet ﷺ said that Allah loved the neighbor and gave so many rights to the neighbor that the Prophet thought that part of the will and inheritance will go to the neighbor. That much importance. Open Safai Sajadiyah. Imam Sajjad alayhi salam has a specific dua for neighbors and relatives. See the importance of neighbors. So the least we can do is support, is ask for help, maintain the social distancing, take all the precautions that we have talked about, but that doesn't mean we should stigmatize. For example, I read reports in India, for example, doctors were taken out of their homes because of the stigma that they could bring in, the virus, for example. So that is not what we should do. So, for example, in Risatul Hukuk, the fourth Imam says that the least we can do for our neighbor is help him and never leave him alone in any calamity. Whether we take this as calamity or we take this as a blessing, there is also a flip side to it. But if someone is sick, we should visit him. If anyhow we can support them, then we should do that.
Interesting, Dr. Muhammad Shabir. You have answered both my questions, even without me asking you the second question. Love the neighbor. Make sure you look after anyone who has developed any symptoms. Go out there, reach out. It doesn't have to be physical reaching out. You can give a call, see what they want, call the doctors, and they will do, which is what is required from them. Dr. Ibrahim, I'm sure parents are very much excited to hear from you. If COVID-19 is not exposable to the kids, then why can't kids go back to school?
Thank you for this question. The only thing is we worry about kids they can infect each other and they can even take the virus at home. And the idea of closing down the school was to slow the progression and transmission of the disease in the community. So if you look at these three interesting facts, so it was worth it to close the school so that the vulnerable members of the community are protected.
Interesting. The last question to you, there is reports of a different disease or a different virus popping up after kids have recovered from COVID-19. How true is that, and are Tanzanians or especially community members exposed to this?
Thank you for this question. There are some reports which were reported also around the world.
Right.
It was reported as a Kawasaki type of illness, but prior to the COVID-19, we also had this illness, Kawasaki. We see it every year, and whereby the children present with vomiting, diarrhea, redness of the eyes, the tongue is red, the lymph nodes are enlarged, one-sided, there is a rash, and there is swelling of the palms and soles of the feet, and also the heart gets affected. And it comes with very high grade persistent fever lasting for more than 4 to 5 days, and
Right.
paracetamol doesn't work, and the child needs to get admitted and needs to be seen by cardiologist because they're at risk of heart disease also, which that way the children can be started on the medicine as soon as possible.
Interesting. You say that, Doctor. Thank you very much. Dr. Manji, you have answered all my questions, but I'm going to put this question to you. Restaurant owners, food lovers, this is going to be something for you. Do not blame me. If you want Dr. Manji's number, I'll give it to you if the answer is not what you are expecting. The question to you, and like they do it in Kon Banega Karapati, Who Wants to Be a Millionaire? I think this is the $1 million question. Can we order food from outside, or can we start eating pan during this pandemic?
Okay, so that is actually not a very difficult question to answer. There are so if in this time, which is a time of difficulty and all these measures are in place,
Right.
one should really be trying to be self-sufficient in their own environment and try and isolate or minimize contact with the outside world.
Right.
Okay, so that is the underlying principle. There is no principle that supersedes that principle. So cook your food. So if it is Eid, you can cook your biryani at home. Okay. Okay, and the reason I'm saying that is not with regards to the food as such, but with regards to, for example, the deliverer who you don't know has gone to deliver in how many places and then has come to your doorstep. So people are focusing.
Dr. Manji, I'll interrupt you there. If I go and pick up my food, is there a problem with that?
If you go and pick up your food, okay, there is someone who's going to give you that food.
Interesting.
Okay, look, I'm absolutely not saying that if it comes to that it has to be done. Okay, it's fine, you can have it. There are no studies that have shown that eating food will give you coronavirus. Okay, so around the circumstances of the delivery of the food or of the pickup of the food, if these conditions of hand hygiene and respiratory hygiene and social isolation or distancing are maintained, no problem.
Yeah. Interesting. I want to ask you an added question to that. Let's talk about our frontliners, those who handle the funeral services. I think they're doing a splendid job, going out there, exposing themselves at these uncertain times. They deserve a lot of credit. But the question that their family members keep asking: can a dead body, give or spread viruses to those who are at the front line in funeral services? Now, I ask this. Irregardless or irrespective of whether they are wearing a PPE or not, is there a chance of a dead body spreading the virus to the one giving the funeral services?
Simple, short answer: there is a small chance, and all precautions need to be taken.
Okay, interesting. Now we go to our final discussion for tonight, the Eid night. Something that's again, I've said this numerous times, but I'm going to repeat it. It's so emotional. This Ramadan has been challenging for everyone. There has been some negatives, but you have been home, you have been safe, you have made it where you are now. You could make it a bit more. Just take the necessary precautions. But before I discuss Eid, I'm going to raise two announcements. Number one, the Dar es Salaam Jamaat and the COVID-19 task force have embarked on a very interesting journey. For those of you who are diabetic, or your family, or your relatives, or your friends who are diabetic, Dar es Salaam Jamaat are giving out free glucose machines. For whoever has been involved into this, there is Samira Pharmacy and the KSIJ COVID-19 task force. These individuals have embarked on this project knowing that our community does have an increase or a very persistent amount of patients who do face sugar issues. So please, those of you who do have or do suffer from diabetes, this is your opportunity to get these machines for free. For those of you who do not have this, please give priority to those who have it so that we can get to the root cause of this problem. Number two, many of you have asked us, how do you get in touch with the COVID-19 helpline? We are going to put up the numbers on the screen and on the comment section on YouTube. Please, it is okay to ask for help. It is okay to call and say, I am suffering. It is okay to ask for help. Do not consider this as a taboo. Do not think that anyone out there is going to target you because you had COVID-19. No, if you save yourself, you will save many more lives. Let's go to the Eid question. For doctors, this is your question. I need an answer, yes or no. Do not tell me this or that. Can I go for my Eid haircut? If yes, I'll come to why yes and why no. But let's start with this. Can I have my Eid haircut? Dr. Molu. If I may add, sorry, Dr. Molu, before you continue answer, can I have my Eid haircut at the salon? I don't want to have it at home. It could create issues between husband and wives, especially for those who have never used the clipper to give your husband a fade, or boys who want to give themselves a haircut, or brothers who want to give their brothers a haircut. Please do not try this at home. Dr. Molu, tell us.
You're stealing my answer, really. You're really stealing my answer. I'm sorry, it's time you hold that trimmer and do it yourself. That's all I'll say.
Interesting. The lucky side to it is we won't see you at home, so we won't have to make fun of your haircut. So that's fine. You can sit at home. Caps are quite available in town right now, so you can make use of that. Dr. Ibrahim, can you or your kids go for a haircut?
No, they haven't.
Huh? That's the most direct answer I've ever heard from a doctor. Do not take your kids for a haircut. Question to you, Dr. Shabir. Can I bring the barber home for him to give me a haircut?
So the answer is principle based, what Dr. Manji explained with regards to the food. You can apply the same principle. You know, medicine is about principles. It's not about specific. If you have one general rule, you can apply it everywhere in life. So the principle is, if you want to minimize the transmission, you have to minimize the contact.
So that means yes or no? Very diplomatic. Can I bring my barber home? Yes or no?
Do it yourself. You become a barber.
These doctors are going to finish us. Dr. Manji, I can't bring the barber home. I can't go for a haircut. What's the solution? Do I still go through this? But the question, however, is if I call the doctor home, if I call the barber home, and if I do give him the PPE, and if I do use my own equipment, is it still a no?
Twist your question, Muhammad Jawad,
Right.
and answer it in a way that is, I think, more helpful to the listeners. So we know that during the time of Eid,
Right.
In the 24 hours around the Eid day, there is a lot of overcrowding in the barber shops. A lot of overcrowding. All the barber shops are very, very full. Okay.
Right.
People are in the salon for up to 4 a.m. at night, 3 a.m., 4 a.m. at night, and that is classic overcrowding.
Right.
Okay, and that will mean lack of social distancing.
Right.
So you see, the question you have asked, there is no answer that is right. Okay.
Okay.
What I would suggest is, if you can do it yourself, do it yourself. Okay. If your spouse can help you, let her help you. Okay. It is her that you are getting that haircut for. Okay, not for everybody.
What a romantic line, Dr. Manji. Quite interesting.
So that is one point. The other point is, if you need to go to the barber shop to get a haircut, okay, try and space it out early. Like from now, you have 10 days before Eid. Okay, if everyone starts going from now, then there will not be that overcrowding, hopefully, in the last 24 hours around the Eid time. Okay, and when you go there, make sure you are wearing a mask, unless you are getting a beard job. But otherwise, if you're getting a haircut, wear your mask. Let your barber wear his mask. Okay, and if your barber is doing his work, his arms are stretched.
Right.
Okay, if his arms are stretched, that is at least 1 meter distance. Okay, I know it is between 1 and 2 meters that is advocated, but if it is a last resort, Okay, then that is how it is supposed to be. Okay, so when you are answering that question, okay, make sure the principles are guiding you. Okay, and then whatever solution comes up will be the middle ground.
Interesting, Dr. Manji. For those wives at home who want a tutorial on how to give a haircut, YouTube is your best answer. But to those of you who own, salons out there are perfect examples here from Dr. Manji, who says that maintain the social distancing rule, maintain the PPE format. So if you have to go on an appointment-based system, I think that's the way forward. Now, interesting, we talked this about haircuts, which is one aspect of Eid, and then there's this other aspect of Eid, which is to meet your family and your friends, to go and visit your loved ones, your grandfather, to go to the cemetery to pay your respects and to remember your loved ones. Now, let's divide this into two. Dr. Muhammad Shabir and Dr. Ibrahim, we will talk about whether you can go and visit your relatives at home. And Dr. Molu and Dr. Manji, we will discuss whether we can have mini social gatherings and whether we can go to the cemetery to offer respect. So, Dr. Muhammad Shabir, can I visit my family on Eid and have my Eid collection done?
It's a very tricky question, but if we keep the general concept in mind, it will ease us answering that. One of the general principles of Islam, because it's a social religion, is Salatul Rahim, to do good with relatives. Now, good with relatives, it's sometimes relative. It's not absolute. You don't need a physical meet to be able to show somebody that you love him or her. At some point in time, you need to be distant away from them to show them your love. So finer instincts of human nature define love, affection, understanding between the family members. There are many benefits of Silatul Rahim, and that is not the topic, but Islam emphasizes Silatul Rahim. We need to understand that it is not the only way to show love to somebody when you can hug somebody and shake somebody. Sometimes staying away, protecting them. Remember, the elderly are the ones who are the most vulnerable. So me and you might fight it out. We might fight it out if we don't have comorbid conditions, if and when we are infected. But we need to protect our parents. We need to protect our grandparents. We need to protect that section of the community whose mortality is 15%. So remember that. Not necessarily that I don't have flu, I don't have cough, then I don't have the infection. As we say that we need to keep the incubation period in mind. It takes up to 4 to 14 days for a person who is infected to show the symptoms. And also there are that percent, almost 15% of not show any symptoms, who are asymptomatic, but they can still be infectious. They can spread the infection. That is the trouble. What else, some solutions that we can show to still show the love and not make them more depressed than they already are, for example, is to call them. A few days ago, during my son's birthday, we had a cake at home. We video called my whole family and we celebrated. Everybody was happy. My son was happy. But more important than happy is being safe. We were all safe. We maintained social distancing and the birthday happened and everybody was happy. We can, for example, if we want to minimize the contact, we can shop and drop. We can buy some mithai or make some mithai, for example, at home and deliver it in a safe way to your parents' home. We can do. We can show acts of service. For example, we can support them emotionally, physically, even the neighbors, for example, if they need help to buy groceries, you can do that. That is also part of showing love and respect to our family, to our relatives, to our neighbors. Yeah? I think
so, yes or no? Is it
Bisharti or shurutia?
Doctors, I tell you, very interesting how they like making you to take the decision so that when you go back to their practices.
Yeah, Allah says in the Quran that do not put yourself into trouble. Anything that you know that can harm you, do not do it.
Interesting, very interesting. Dr. Ibrahim, let's come to you. I have two questions for you. One is to do with the kids. in the sense of Eid? Obviously, I'm pretty sure you will be abiding to what Dr. Muhammad Shabir has said in regards to whether kids can visit family members or not. But one of the most interesting questions that we have received is in regards to having pets at home. Can pets actually, get coronavirus? Okay, can they actually spread this virus?
Very interesting question. There are reported cases whereby actually they tested the cats, the dogs at home, and they were found to have coronavirus. But if you come into contact with these pets, definitely the risk of transmission is very high.
Okay. So what do I do with my pet?
Very difficult thing. Rather stay safe, isolate them, but make sure you make sure that they get the daily necessities like food,
Right.
like it's been given to them. But nothing much I could add to it. It's a very difficult question.
Okay. Let me ask you this question: will you let your kids visit anyone this Eid?
The answer is no.
Okay.
If they want to speak to anyone, we can do video call, as Muhammad Shabi said. And
Okay.
it's not much that we must meet physically. We do handshakes and hugs. We have emojis, we have technologies. You can send hugs and kisses, handshakes to your phone. And if they're worried about ED, we have M-Pesa. It can be sent through M-Pesa to the phone.
Very interesting. I tell you, these doctors are very smart in the way they get the message across. Looks like Dr. Ibrahim uses a lot of emojis to express himself. I'm very impressed with that. I thought I was the only one. Let's get to you, Dr. Molu. Kabristan visits in COVID-19. Now, I'm sure that Jamaat leadership will send out a message in regards to what the plan is for this Eid in regards to mosque visits and Kabristan visits. But the question here is, do we go to Kabristan? Can we go to Kabristan? Can we offer respects, or do we just sit at home and pray for them?
I think, Moja, the key issue here is discipline. And if you see currently our mosque for namaz is open to the community to offer their prayers, but there is a strict way of maintaining discipline there. There's good social distancing, there's good protective, measures where, there's no sharing of spaces, there's gaps between how people pray. And so when it comes to visiting the Kabristan, we could probably think of a similar, method whereby the principles that are there when it comes to prevention, primary prevention, they need to be adhered to. If we are going to maintain social distancing, if we are going to prevent overcrowding, if we are going to wear our masks and maintain hand hygiene and respiratory hygiene, then I don't see a problem with us, visiting the cricket.
Interesting. Dr. Manji, my question to you is to give us a conclusion, from on behalf of all the doctors who have been on this panel. Your concluding remarks before I have a few announcements and my concluding remarks. What's your concluding remark for this community in regards to COVID-19?
Concluding remarks. I want to send a message of preparedness and vigilance.
Right.
I want to send a message of calm and being not in a state of panic. Okay, the community has done a lot for the community members. The medical teams have done a lot for the community members. They are still there. They are still working for you. A message of calm also to the Mayat committee. Okay, that what you are doing is indeed a great job. Okay, the risk is there, but it is small. Please do not panic so much. Use the right precautions. All the doctors should use the right precautions. The community, as I said, the level of vigilance has to be up there. Let us not lax in this social responsibility.
Right.
Okay, because if we celebrate Eid, okay, then after Eid, then there is going to be a lot of mourning. Okay, so let us celebrate these grand nights and these occasions with sense and with logic, maintain all the precautions, and inshallah this storm will soon be over.
Thank you, Dr. Manji. Before we end tonight's show, I just want to inform our dear viewers, we have a show on Sunday, a talk show about mental health, which will discuss the trauma that comes with COVID-19 and sitting at home and maintain social distancing. But before I give my concluding remarks, I want to send my sincere appreciation on behalf of everyone at this COVID-19 task force team and the doctors who have agreed to come on the show. I think you guys have done a fantastic job in bringing a bit of calmness and steadiness in this community. For that, may Allah subhanahu wa ta'ala reward you. But also, I think I speak for the community members on behalf of them. I want to extend my sincere appreciation to the Jamaat leadership, to the COVID-19 task force, to our frontliners, including the doctors, including volunteers at mosque, giving out iftar, cooking the food at mosque, Mayat committee, hospital management, everyone who in one way or the other, ambulance services who have contributed in one way or other to bring calmness and steadiness in this community, but most of all to ensure that COVID-19 does not affect our community and therefore to maintain a healthy and safe community. But dear members, before I end, I just want to remind all of you that when the Jamaat issues a statement, it is not to put us down or to bring issues to us, but it is for our safety. The Jamaat leadership is there to look after ourselves, and therefore, whenever a statement is issued by the Jamaat, please abide by it. Like Dr. Manji said, if you do not look after yourselves on this Eid, there'll be a lot more mourning that will come after that. Let's use this Eid as a means to, stay safe at home, in a means to, further extend our relationship with family using technology. But most of all, make sure that this Eid is one where you set an example to your relatives and your family members. Use it as a means to promote, health and safety. But most of all, my dear viewers, remember, it is okay to ask for help. It is okay if you've developed symptoms. You will not be targeted by anyone. You will not be judged. Call the call center. Call and ask for help. Ask them what you can do. What's going to happen next will be done by the COVID task force team. Please, please, please do not take this easy. Do not treat this as a joke. This is a serious matter. Stay safe. Most of all, stay home when you can. Whenever possible, please ensure that your relatives, your family, and your loved ones are looked after. We, as community members, do not take pride in burying people. That is not what our community is there for. Our community is there to promote health and safety. But most of all, every one of you plays a different role in the development and in the growing of this community, and therefore we do not want to lose you. So please treat this as a warning from the medical staff. Make sure this Eid you stay home, stay safe, have your biryanis with your loved ones. And remember that our frontliners, our doctors, our volunteers at mosque are in need of your prayers, because prayers are one of the most important ways of ensuring the health and safety of the community. To my dear panel, I have had an absolute pleasure to host you, but most of all, I now feel like I'm 50%, doctor, Google doctor. I wouldn't say I am a certified doctor by now, but it has been an absolute pleasure. And you guys have been amazing. Thank you for telling us that it is okay, to do whatever you have told us. It is okay to stay at home. But most of all, thank you for bringing calmness into our hearts. And I'm sure everyone on these holy nights will pray for you and your family, for your health and for your safety. And may you, once again, be granted the opportunity to be amongst the frontliners when the Imam al-Hujjah reappears, so that you can be of service to him and our religion. On that note, to our media team, media room, thank you very much for facilitating this talk show. To the COVID-19 task force team for bringing up this idea, thank you very much. Make sure diabetic patients ask for the glucose machines. For those of you who have symptoms, call the COVID-19 task force call center, and they will be able to assist you. On a final note, please remember everyone in your du'as on these holy nights, and make sure that this Eid is one that makes you stay at home, but most of all, stay safe. Assalamu alaikum wa rahmatullahi wa barakatuh.
اللهم صل على محمد وآل محمد. اللهم صل إلهي عظم البناء وبرح الخفاء وانكشف الغطاء وانقطع الرجاء وضاقت الأرض ومنعت السماء وأنت المستعان وإليك المشتكى وعليك المعول في الشدة والرخاء. اللهم صل على محمد وآل محمد أولي الأمر الذين فرضت علينا طاعتهم وعرفتنا بذلك منزلتهم ففرج عنا بحقهم فرجا عاجلا قريبا كلمح البصر أو هو أقرب. يا محمد يا علي يا علي يا محمد اكفياني فإنكما كافيان وانصراني فإنكما ناصران. يا مولانا يا صاحب الزمان الغوث 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 أدركني 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 الساعة 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 العجلة العجلة العجلة. يا أرحم الراحمين بحق محمد وآل بيته الطيبين الطاهرين.